Yes, well, good afternoon, and I hope everybody is able to enjoy a Canada Day yesterday. I did have a special mask made for me with Canadian flags on it, so I did wear it yesterday and today. I didn't bring it up to the front here, but ways to celebrate Canada Day, and I thought a lot of the messaging was very much around Canadians coming together to deal with COVID-19 in many amazing ways, communities coming together, people supporting one another, and people staying to the task of seeking to contain COVID-19 in many ways, recognizing the variation across the country and the fact that we're still trying to do this as a pan-Canadian approach and to demonstrate the Canadian ways of dealing with this issue, as it has now gone on to well over 157 days since we had our first case. You notice that it's been 3 weeks since 24 of our 34 regions entered stage 2, 2 weeks since the further 7, and of course less time with the 2, and we still have the remaining 2 communities in the Windsor-Essex area waiting to go to stage 2, and we're hoping to continue to monitor that situation as we have had ongoing outbreaks in that locale. It's also been 3 weeks this Friday when we started to initiate social circles. So that has been another metric we want to look at here. And overall, we're trying to see that the trends have been positive. We'll talk about the numbers shortly. What we've seen is that while our numbers have stayed in the mid 100s, upper 100 levels, the testing has continued to be robust, and we see that the positivity rate, as I'll talk about in a moment, has been at 1%, and just today dropped down, or I should say yesterday, down to 0.8, and that's positive, as well as the other metrics I'm going to talk about with long-term care and retirement homes. All are in a good direction. Our R0, that's community transmission level, has been hovering around 1. We would like to see that get below that in there. What we have seen is that our numbers vary where they are in the province depending on outbreaks. And that's been a difference. Rather than community-wide spread, we're seeing a different of our health units dealing with outbreaks of various types and various locations and of various sizes. You've heard about the one in Kingston with the nail salon and how that investigative case contact led to notification of a lot of people to be in isolation. A lot of positive cases are located and determined. And this is the concept around case contact, what we call containment, that we're looking for on a go-forward basis, knowing we'll see these from time to time throughout the summer, and those would all have epidemiological linked sources. So before we move into stage 3, we're continuing to watch this situation to see how the overall positivity is, the change in the positivity rates of lab tests, the volume of lab tests, the number that are outbreak related as compared to community-wide spread, and to see if there's wide variation among our different areas of the provinces and province and the regions in there. So we want to do this carefully. We're all watching with concern issues south of the border in the U.S. and the various states as their numbers are escalating, and they have had in some states the requirement to turn back some of their public health measures from opening up, going back tighter again to see if they can contain what seems to be a fairly rapid expansion in cases, probably due to testing as well as further ongoing spread in that. So we certainly would like to definitely avoid that in Ontario and Canada. And moving towards the fall, see if we can get down to a level where we might be able to work assertively at keeping a second wave, as is forecasted, down and curtailing its impact upon us in that aspect there. So that's our general approach during the week here. If we look at the general messaging, I'll talk about that in a moment. Our testing, we had a total of 35,370 confirmed cases in Ontario as reported as of yesterday. And over the last 3 days, Tuesday we had 157, Wednesday 149, and today 153. So with the variation, pretty well the same amount. But as I said, it moved around from which health units had more cases or less cases in those 3 days as they dealt with an outbreak here, an outbreak there, and that is reassuring in that matter. And the vast majority had less than 5 cases, and some in the north have had no cases for 1 or 2 or 3 days. So that's encouraging as well. In our recent one, Toronto had 71, York 27, and Peel 24. So about 80% of the cases were in the GTA area this time, whereas a few days earlier, they're more out in the outer area due to the outbreak on one of the institutions in the area of Windsor, Essex. The number of deaths has continued. We had an increase of 15 since Monday. So 4 yesterday, 4 today, and there's different numbers coming out from long-term care. And unfortunately, those are still occurring, but they're a lot less than what we experienced a few weeks ago, fortunately. The number recovered continues to increase. We had 204 recovered, bringing our total to 30,730. That's 87% have recovered. Lab testing, again, another day over 20,000. We had 24,322 tests. And as I said before, the positivity rate has dipped down to 0.8%. In our long-term care facilities, those outbreaks continue to drop. We're down to 46. No new deaths reported in those settings. Our residents and staff cases continue to diminish. And our retirement homes only have 4 current outbreaks recorded. Again, no change in deaths, and their staff and resident numbers continue to diminish as well. So all these are good metrics of looking forward over the coming weekend. The last half of some people are taken as the Canada Day weekend, and we'll see how those numbers deal with on Monday. And as we continue to review that, to see if we have a good solid 3 weeks and a weekend of data for some health units at level 2, and some more getting close to that for level 2 before we consider going to level 3. So overall, going well. We have those general messages that we have been emphasizing, that even though we're opening up more and more, even if we go to stage 3, there's still a need to do what you need to do to protect yourself and those around you. And again, the same message of keeping your distance, wearing a fabric face covering when you're in public places. And some places have gone to mandatory in certain settings because the risk is much higher of close contact, and where people have either been unable or unwilling to wear them in internal closed settings. And so some health units, some medical officer of health, as is in their jurisdiction, have issued Section 22 orders requiring the mandating of facial coverings in indoor spaces to continue to encourage people to do what they need to do to protect themselves and others in that. And of course, there's the ongoing aspect of hand hygiene, washing your hands, and to continue to keep track of your contacts in that, in case there is some attribution and you need to identify who those were. So that has to be continued now, social circles included. And if we go to stage 3, those same things will continue to apply in that. And so there won't be any relaxing of those advice points in stage 3 regardless. So that's the aspects there. And on the federal, provincial, territorial level, we continue to review a number of things related to the testing of asymptomatic individuals, the interpretation of the lab tests accordingly, and monitoring that on a day-to-day basis. So with that, I'm going to take questions from the media.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up, and please join the queue if you have any questions. First question.
First question will be from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Doctor. I just wanted to clarify something the Premier was saying in his news conference. He said migrant workers or farm workers, not just migrant workers, I guess, are hiding from testing in Essex County. I'm wondering what you have heard on that front, and also he seemed to be quite disapproving of the medical officer of health down there, essentially effectively shutting down the farm, the greenhouse operation in Leamington, where they've had 191 cases. What options did you see there? Because Dr. Yaffe on Tuesday said that closing that farm was one of the options.
So I'm not sure exactly what the Premier said in the aspect of this facility that you're alluding to, the one that Dr. Yaffe referred to on Tuesday. I had been away and I reviewed the aspects in that and noted that a lot of our aspects before with asymptomatic testing was that we would do the testing at locations where we didn't know there's any cases there and there was no outbreak at that time or previously in that, and was dealing mostly with the farms in our definition. So I think in this location here, I become aware of that this actual facility has two things different in my mind. One, there was an outbreak in this facility of well over 30 cases at the end of May going to early June. So it wasn't a history of no outbreaks at all. It's a large setup. And so there's still some follow-up on that. So in fact, it was like a testing of a previous outbreak facility. And furthermore, I understood this is not a farm in what we define as an outdoor farm with large number of acreages. It is a large industrial greenhouse operation, which is different in my mind because it's a different work setting, and it has close space, people working in close quarters, different aspects around humidity in that aspect that might facilitate more transmission, as well as the HVAC system is much different than working out in an open field. So in that matter, the medical officer of health has the capacity to declare an outbreak. As I understood, they found not only positive cases asymptomatic, they found a number of symptomatic cases, which means you have an outbreak. And so it's not an asymptomatic testing situation, it's an outbreak within an industrial workplace site, much like we have with other ones around the province, and it has to be handled that way accordingly, which means you have to put in orders that limit what people can or can't do in around there, because not only do they have a work site, they also have a concrete setting, living site, and people have to be isolated accordingly. So a complex task that has to be carried out in a timely way to limit further spread to those that aren't positive, and other staff in that issue there to keep them protected, and to protect and monitor those that are positive and symptomatic to make sure they don't get any severe sequelae, and also those that are positive and seem to have no symptoms because they could be early cases and be converted. So all those have to be monitored very carefully over the next 2 weeks. But in that sense, it's an outbreak situation. As far as the other places, I understand ongoing testing is taking place. There's lots of methods in place there to reassure workers that you are being tested not in any punitive way, but to protect you, because you'd be much better to get tested, be monitored carefully, get the health care when you need it, regardless if you're visiting in the country under the workers' monitor. And you can get the coverage and care you need, as well as compensation, all the aspects that the premiums referred to in the past. So we're trying to make sure that's available in all languages, especially in Spanish in this case, and other similar ones that would inform the workers of their capacity to access these resources, because our intent is to protect the workers and not to take out any punitive action, because if we don't take action, they don't get tested, and there's ongoing transmission like within this facility, then others are put at risk and potentially could require hospitalization in some patients and maybe more severe consequences. So you asked a number of questions all at once. I hope I covered those adequately, Rob.
Follow-up, and just a reminder to join the queue if you have any questions.
Yeah, you did a great job. Thank you. I just wanted to follow up on that with the local medical local health unit down there said they're working with the health ministry here on housing these workers and isolating these workers. Are they all going in hotels? And is this farm, this greenhouse operation, pretty much shut down?
The first question is the answer, yes, we have acquired hotel facilities, and some have been acquired already by the owner, and so we're making sure that individuals can be isolated. And when you not only isolate them in hotel rooms, you have to make sure you provide the other services they need, so they don't have to go out and acquire those, food, other needs, et cetera, et cetera. So it's not just giving them a room. You have to have the support services so they can maintain the isolation for that 2-week period, including any need for further assessments and testing. The second part is the closing down. When you have a industry that has a close quarters and you have an outbreak of uncertain extent and transmission, you usually have to carry out in order to close down the operation as much as possible, maintaining some essential things if necessary, but to close that down so you can contain contact and spread, or you just have it propagating through the whole thing after a while, and you put more staff at risk by not closing it down. But by closing it down, taking remedial action very quickly, you might have the opportunity to open it up again sooner once you have cleared it from any evidence of ongoing transmission.
Next question, and this will be the last question unless anyone else joins the queue.
Next question will be from Cynthia Mulligan at City News. Please go ahead.
Hello, doctor. So in looking at the numbers by region, and as you mentioned earlier, 23 out of the 34 regions across the province today reported 0 cases. It seems to indicate stage 3 by region could potentially be coming sooner than later. And I was wondering if you could give us some more details about what stage 3 could look like. Are you looking to potentially increase public gatherings beyond 10? Could maybe family bubbles be expanded yet again?
So all things are on the table. I know our public health measures table is reviewing all the different components, and generally in the idea of stage 3, when you open up more and more aspects in our society, you're looking at more and more public type things. So certainly looking at the size of public gatherings is one thing we want to look at, knowing if people will have demonstrated in stage 2, have they been able to do these other ones and maintain those points I talked about, the distancing, the facial covering, et cetera, et cetera. If you can do it in that small context, can you do it in a larger one? If you can do it in a gathering of 10, could you do it in a gathering 20, 30, or 40 or something like that, and still be disciplined enough to do that? We have to have some faltering in that. As the One Health News reported, gatherings of young people where they did not maintain that, and they've had a number of cases reported in that. And we've also had some institutions, as you noticed about the one in Kingston, where they were not vigilant on the staff monitoring and health conditions and protocols. So there has been a number, well over 700 people impacted by that. So you can see how a few cases and a little bit of carelessness can result in a large-scale impact if you know how to contain it by having done a lot of people the right thing, and that your social circle, or if you go to more circles, as we're trying to look at, then instead of being able to just monitor 9 people, you may have to monitor 19. And you know those where. And I've always seen examples where people said, we thought we had a case, we quickly could communicate with our rest of our group in our social circle. We all took precautions, and we waited, and we found the person was tested negative, so it was a sigh of relief, but we were all satisfied in our circle that we were kept informed within our group. So these are things we're looking at as we look at how to engage in the larger type aspects and still maintaining those safety precautions that I've alluded to before.
Follow up.
Thank you. As you noted, it's 3 weeks tomorrow since stage 2 started opening up in most of the province, except largely for the GTA. Are you pleased so far about overall how Ontario has done since the opening up started?
Yes, I am pleased. I mean, yes, I see reports, I hear comments, and I think that's true. Ontarians are well engaged in this process, and I think are heavily invested in it. And so I know when we talk about things like masking and mandatory and different things, and the difficulty of enforcing that, we have a lot of enforcement agents out there called the public. And I know the public have a commentary to make about an opinion, because you're not only responsible to authorities, you're responsible to your fellow citizens. And everybody is invested in this personally over the last number of months and does not want to waste that investment. So while, as I said before, you may not think it's the greatest thing for you, you need to respect your fellow citizens and carry that out. And for the most part, I've seen people doing that. I see some infractions, sometimes in casualness. I think they have to keep at the discipline. I know it's hard to stay the course, but as we're giving more and more things to do, as we're widening those things, I think we can stay at it. Most of our case numbers, as I noted, were related to outbreaks around an activity. And that means we haven't seen a real big rise in community-wide spread, which I was concerned about. So if it's related to a less than quality social distancing in a social event and was cordoned off, we can handle that and give them advice and education don't do that again. If it's in a workplace where there's been less than quality infection prevention control practices, distancing, that can be counseled and worked on, and so you can continue to do those preventative messages in those different settings. Once it goes community-wide and people are being way too casual, then you lose that. I have not seen that in the stage 2, and so that is reassuring as our numbers come down. We're staying in the mid-hundreds. I'd like to get that down to the low hundreds, like we had one last week. I'd like to get one nudging below 100 if we could. And also the positivity rate going down, and that so-called RT or R naught number going down as well, hedging below 1 down to, I'd like it down to 0.8 or 0.7 if we could on a province-wide basis. So all going in the right direction, all reassuring at this time.
We have one more question, so this will be the last question.
From Sinead Dugal at Queen's Park Briefing. Please go ahead.
Hi, Dr. Williams. Thanks for taking my question. Sorry, I'm not sure if you addressed this already, but more than 700 healthcare professionals have signed on to a letter that, as I understand, was sent to your office today. They're concerned about your guidance on asymptomatic people being able to continue working and the impact on migrant farm workers. They say that they think that the guidance can't be safely followed or consistently applied, and that it does little to address the root causes of some of these outbreaks that we're seeing, which they say are poor working and living conditions. So they're asking you to revoke this guidance. I'm just wondering what your response is to that and whether that is something that you would consider doing.
So I did just receive a copy of the letter. I think it was from physicians, mostly, about 700. I'm not sure where they're from. I think it raises the need. They want to understand the details of, I think, the most recent one that we've been referring to when I was asking Rob's question, in that where the original one was put out, for example, if you're dealing with a agri-industry, a farm that has a wide acreage and staff are spread all over the place, and they have 1 or 2 cases that are tested asymptomatic in the asymptomatic screening protocol, and what to do that where there's been no outbreaks in the facility, no cases that are found out to be symptomatic at all, and what to do with those, because we were concerned about the testing may have been a resolving case that has no infectivity and may just need a repeat lab test in 48 hours to rule in or rule out, and while you're monitoring to make sure you didn't miss anything. In the situation we're talking about, as I said before, the difference is that this facility they tested with has the large number in it was one there where there had been an outbreak already, a fairly extensive one, just 3 to 4 weeks prior to the follow-up testing. So it did not meet the definition of an asymptomatic testing protocol. As well, a number of the cases they found when they did the testing were already symptomatic. So it was not a case of asymptomatic testing. It was an outbreak investigation, and it has been handled as an outbreak. So in that case, the protocol for asymptomatic workers continue working does not apply. And you've seen the direction by the local medical officer of health to put out a 22 saying no one is working. In that situation, everybody is in isolation and monitoring because it is an outbreak. It's not a screening test of an asymptomatic situation with no cases symptomatic and no past outbreaks. So I agree on that situation. I think the assertions that are in the letter, the concerns that have already been raised already by a number of others around the working situation, the support services and other things necessary to improve the situation of migrant farm workers in Ontario, I think they're all relevant as well. So I think it's applying the right tool to the right place at the right time and dealing with the circumstances. So I would agree with their letter that this asymptomatic tool that we've been using did not apply in this last situation, which is an outbreak in a industrial agricultural facility that is indoors in a greenhouse setting, quite different than what is set originally for being outdoor farming areas. So in a way, I agree somewhat with the letter, and the concerns are always important ones to consider.
Follow up, this is the last question.
No, I'm good. Thank you.
Everyone.